HealthTech listeners, I'm your host this week, Rebecca Lindley, Brand and Communications Manager at Radar Healthcare. This is the podcast where we tackle some of the trending topics, best practice and ideas within health and social care. In today's episode, we're joined by Blythe Senior, Director of Professional Services at Guided Innovation, to explore how care organisations can successfully navigate the complex world of care technology. Welcome to the podcast.
Hi, thank you for having me.
So can we start by just hearing a little bit more about the work that you do at Guided Innovation?
Yeah, so my job title is Director of Professional Services, a bit of a mouthful. On a day-to-day basis, I kind of act as a programme manager, looking after our team of project and change managers. We've got over 50 years of experience within our team working in social care, implementing various technologies across different organisations, whether that's a dom care, supported living, residential care, in your mental health settings, learning disability, elderly care, etc. We literally kind of can work anywhere.
A lot. Yeah.
So we work with lots of different organisations, as I said there, and I started my journey in social care working for a national brain injury charity, and I found it so rewarding to know that what I was doing was helping to make a difference to people's lives, albeit I was kind of more in an office-based role. The things that we were doing in the office were making a big difference to people's lives with doing the rostering, dealing with the incidents, etc., and doing the quality and compliance side of things. So myself and my co-director Grant both worked there together, and then we did hit some red tape and politics and some of the challenges we see now in the job we work in, working with other organisations, and we decided to set up Guide Innovation with the aim to help as many care companies as we can to implement technology successfully and to digitise their paper-based systems.
Yeah.
We didn't want people to be kind of struggling with that on their own, or really expensive consultants coming in and charging them the earth for that. So we've come in to try and help to solve that problem. So we've got a team of projects and change managers, we've got trainers, and they all kind of learn all the different systems on the market. And then we work with the different care organisations. Some of them we will do procurement exercises with and help them actually choose the right tech.
Yeah.
Some of them we will do the implementations for, and then others we just purely provide kind of project management services or just digital training for. So it really kind of depends what the kind of scope of work we've got as to what we do. And the most satisfying thing for us is to see that that's gone well at the end of the project and people are sat there kind of saying, well, what's next then?
Yeah.
What do we do? Where do we go? Do we have EMA next? Do we have care planning?
Yeah. I mean, it's a really rewarding industry to work in, isn't it? I mean, working for Radar Healthcare, it's the first time that I've worked in healthcare, and just working from like a tech perspective and getting to work with partners that work on the front line and stuff like that, it is a really nice sector to be in, isn't it?
Yeah, there's so much reward that you can get from all the different roles that anyone works in. Even if you're not a frontline kind of care worker, you get a lot of reward.
Yeah, definitely. So could you tell us a little bit more about, I know you touched on it slightly there, but how your company kind of works alongside and helps care organisations navigate the tech landscape?
Yeah, so we've been to the various care shows and we've met a lot of our customers there. We obviously get a lot of people coming to us because they've heard about us, and then we'll kind of just get to know where they are right now on their digital journey. Are they looking to start their digital journey and actually procure something, or are they just looking for a bit of advice as to where to even start thinking about what's next for them? Or have they already bought a system and they're actually looking to actually implement it and they just need some help with that because they've got resourcing issues? So we kind of have a really broad horizon across the supplier market there. We are always horizon scanning to see what's out there, what's the best, what might be best for one company and not for another. There's so much variety out there now in the polluted market. So we kind of take it as our job to be experts in what's available and then advise our customers basically. So it can be any kind of one of those journeys, procurement, implementation, or even just helping them start with a bit of a digital strategy as to what they actually want to do.
Yeah.
So yeah, it can really vary in terms of that.
Yeah, and that's a really good point, isn't it, around that not all tech's going to suit every single care organisation. Yeah. Everyone's unique and they have their own unique KPIs and goals and outcomes that they want to get from the tech. Yeah. So then my next question is, obviously, being in the industry, you'll know that there is a lot of tech on the market, and I guess it can be really overwhelming for organisations to know kind of which technology to invest in. So what kind of advice would you give for anyone that's looking to start to invest in a piece of technology?
If you've got time, go to one of the care shows. There's so many out there. There might be one of the smaller ones that are in your more local area, or there's obviously the care show that's at Birmingham and London, which are very well attended. And then there's the road shows as well.
Yeah.
So there's lots of different options. You don't have to travel miles to get to one of those, and just go and meet some suppliers. Go and sit in some talks and start that kind of education journey if you've not already got on that side of things. If you go on Google, depending on what you search for, you could be 10, 20 pages deep before you get to the end of the results, and who's got time to sit there and do that? Whereas if you go to a show, you might even get some demos while you're there and get to see and feel what a system looks like. So there is a lot of benefit to attending a show. There's also a new online platform called HealthTech Guide, which care providers can sign up to for free, and there's over 500 products on there from over 400 suppliers. So that's a good place to start. There's lots of filter options on there. You could filter just for care planning, and then you'll find all the suitable systems that are available. So that's a really good place to start if you're just having a look at what's out there and you're not ready to kind of start purchasing yet. If you are kind of ready to start buying a technology, you obviously need to start thinking about procurement at that stage and making sure that you have some ideas as to what you're looking to buy. And what problems you're looking to fix. And that kind of will lead you into where you're kind of looking and what systems you're looking for. Some people will literally come and speak to us though and say, I want to solve high agency usage. What system do I need? Yeah. You know, there's not always a clear-cut system that will solve a problem that you might be experiencing. It might be a multitude of systems. And so some people just need that guidance as to what even system to look for.
Yeah. Yeah. I think that's a really good point about the care shows and all that, and like attending the industry events, isn't it? Because sometimes you just see them as almost like just things to kind of attend to get like knowledge and information and stuff like that from the speaker sessions. But there's obviously so many vendors there and tech suppliers that are there to, like you said, give you almost like a demo so you can almost try before you buy, I guess.
Yeah, definitely. And, you know, we've seen people going round where they've literally been like, can we have a look then? And actually get a feel for it. And then they've started talking, you know, another customer might walk on there. It might be an existing customer and they'll get talking to them and then you'll learn about their experience of that product. So there is a lot of opportunities by attending a care show. Like you say, some people think they're just to go and sit at the talks or it's just for suppliers to sell to you. But actually it can be a really good place for you to kind of get a feel for what those suppliers are like and whether you like them. At the end of the day, if you're going to get a 3-year contract with a supplier, you need to know that they're a team of people that seem friendly and are going to fill your needs that you need from your system.
Yeah, definitely. It's a partnership at the end of the day, isn't it? Yeah. And how important is it to have a clear strategy before diving into a procurement?
Tricky question. I think some people get hung up on having a digital strategy and having a really clear strategy as to what you need to do and kind of you're going to implement this system. Then in the next budget, you're going to do this system. Some people are not in that position and, you know, might be talking about a small care home group who don't have kind of a big central team who can organise all that, or you don't have an IT infrastructure team. So I'd say if you're a mature organisation and you can have a digital strategy, fantastic. It's a very similar kind of philosophy, even if you're big or small and you've got that team or not to build a digital strategy. The main thing is to focus on what problems you're trying to solve. At the end of the day, you're trying to buy a system to either bring you efficiencies, bring you quality improvement, reduce risks around your paper-based processes or existing systems that you've got that are now outdated, or you're looking to innovate. So those are the kind of things that people buy digital systems for, and that's why it's important to kind of focus on what the problem you're trying to fix is and then find the solution for that. That might mean you're focusing on that kind of piece of work for a year, 2 years, 3 years, or that might be a 2-month piece of work and you're ready to move on to the next one. I think people focus on too much about what should we do in what order, and it's not always about that. It's just finding that biggest problem that you need to solve first.
Yeah, and I think that's a really key takeaway, isn't it, from this podcast? Because I think a lot of people think, oh, we're going into this digital age, I need to buy tech, and then they try to fit their organisation around that tech, where it should be the other way around, shouldn't it?
Yeah, the tech should just slot into place kind of in your organisation, and then, you know, you'll build your processes around it to a degree. Some people kind of focus on this lift and shift idea in that a system should work exactly how your paper process did, But actually, sometimes you need to transform your processes whilst you're implementing a system, and realise that actually it can be a better process by digitising it. So there can be this kind of, I mean, we've experienced it lots of times with Guide Innovation when we're implementing, people are like, yeah, but we do it this way. I'm like, well, the system does it this way. This is what you've purchased. And so actually, let's give it a go first, because it might be a better way of doing things. And then a lot of the time, once people get the head round how that works, they then realise actually that's a lot better way of doing things than their original paper forms and things that they had.
Yeah. And then building on that then, how can organisations ensure that they're choosing solutions that fit their specific needs? So obviously we've talked a little bit around that. It's really important to put almost like the outcomes, the impact first. What problems are you trying to solve? So how can we just break that down a little bit for our listeners?
Yeah, so if you were thinking about procuring a system and kind of looking at what your specific needs are, some of the key things to consider are when you're buying that system is it going to meet your regulatory compliance? Is it going to satisfy your CQC standards or the NHS DSPT? Are you going to meet your GDPR standards and policies that you have within your organisation? You've got to be considerate of your security measures, so making sure that they've got the right accreditations to be holding your data, so that you're secure in that sense as well. A big focus would be to be thinking about user friendliness and accessibility. At the end of the day, a system should be quite easy to implement for your staff. Nobody wants to be attending a 2-day training course just to be able to use the next care planning system. Your managers may be on a bit more of an intensive course for training, but in terms of your end users and your support workers or your carers, ideally they'd be able to, watch some videos, attend a short training session, have some guides that they can kind of learn from as they're going and learning from the experience, and just get an app in their hands and run with it.
Yeah.
So I definitely say when you're looking at buying a system, that would be one of your specific needs, is making sure that it's usable. We've got a varying age profile in social care, and we've got varying digital skills. Some of our younger workers just want tech and they just want to be able to get on with it. It's an expectation, whereas we do have a lot of older people working in our industry that have probably don't even have a smartphone. And so we need to make sure that system will be able to be used by all of those varying needs that we've got.
Yeah, inclusive. Yeah, definitely.
Again, focusing on interoperability and integration. So just because you might only have one system right now, you've got to think about the future. I mentioned earlier about you might be tied into a 3 or 5 year contract with your software supplier. Within that 3 or 5 years, you might have bought 4 more systems and implemented them. And so you've got to start thinking about that integration from early doors is definitely something to consider. Making sure that you're future-proofing what you're buying into your organisation. Because, if you start with a HR system, for example, then you buy a rostering system. The rostering system needs your staff data. Then you buy a care planning system. Your care planning system needs your staff data. How many times when you get a new starter would you have to manually enter that into each system before you decide, actually, we need an integration here? And so many systems on the market now have kind of plugins between each other, or they'll have like an open API where you can kind of build your own integration. There's lots of people out there that can help with that, just because you don't have your own IT team that can develop that themselves. So definitely considering that future-proofing as well when you're buying a system.
So with obviously people struggling with budgets and things like that, how would you advise around cost?
Yeah, so when you're looking at procurement, it's important to not ignore the cost of a system, but to look beyond it a little bit, because the benefits that you can get from a system could far outweigh the cost upfront or your licensing cost that you have recurring. It's important to focus on that return on investment. And it may not be a monetary return on investment. It may be a time saving where you can actually then provide better care, and your staff can provide more kind of personal time with the people that you're supporting, rather than sitting and doing desk jobs or printing and writing lots of things up. So it is really important to focus on that return on investment and focus on the benefits you can get from a system to then outweigh that cost approach to it. Obviously, there are some quite expensive systems on the market, and then there are, you've got your middle range. So again, considering that with your budget that you've got available to you, but always think about that return on investment, not just the price tag that's attached to a system.
Yeah, and I think that's a really good point, isn't it? Around it's almost like setting those expectations and outcomes first, and then justifying whether or not that system meets the things that you expected it to.
Absolutely. You've always got to go back and look at whether you've met those benefits at the end of your implementation, because otherwise that's kind of your motivation then to buy your next system. Otherwise your board might be sat there, or your manager's thinking, well, we've spent a lot of money on this system and I'm not really sure we've actually seen what we thought we were going to get out of it. So it's important to have that look back before you move to the next system, definitely.
And then speaking of implementation then, so once chosen a system, what are kind of like the critical steps to ensure smooth implementation?
Yeah, so a lot of planning and kind of preparation at the start of your implementation, speaking to a lot of people. Hopefully, if you've done your procurement, you'll have been speaking to people and finding out what they want from a system. So that'll give you a good idea moving into the actual implementation. It's important to get a rollout plan together and understand, you may have multiple services or you may just have one service, and so your rollout plan may be a lot smaller. But if you're a larger organisation with lots of services or regions, it's important there to kind of think about whether you want phases. So you might chunk some services together in a phase 1, which will go live 1 month, and then a phase 2, which will go live the following month, etc. And whether you need some phases within that as well to kind of reassess where you're at. And that part is so important to speak with the managers about and make sure they're ready. For all you know, you might plan to take a service live in March and the manager's on annual leave. Have you considered that your managers may take annual leave? Once you've got your rollout plan together, obviously you've got your goals that you've already thought about from your procurement side of things. You need to get kind of a bit of a project team together. The most unsuccessful implementations we see are where there's nobody kind of managing it from a central point of view. It can be anybody in your teams who, is really good at organisation and chasing people up. But having one kind of person who can be that central point of following up on things and making sure that you're sticking to plan. Some organisations will absolutely have a project management team, and that's obviously the perfect people to do that. But having a project team who've got some capacity to be able to work on this, because, a lot of people go into this and think, oh yeah, I can do it alongside my day job. But actually then it gets on top of them, they start getting behind, and then they can't keep up with what they're trying to do. So once you've got that kind of resource together as a project team, they can then start organising when you're going to do things alongside your rollout plan, making sure that you're communicating with your staff and keeping them up to date. Some people will have a comms team, fantastic. They can kind of take that off your plate and deal with that. And you may have training provided by a supplier, or you may need to do that training internally, and it'll be more like a train the trainer methodology. So again, just planning for those kind of things with your resource there and making sure that you're ready for what you've got to do next so that you don't start tripping over and getting those delays. People like pilots. At Guide Innovation, we don't like pilots. Pilots are good if you kind of are testing out a software and, you've maybe not put as much rigor around it as we probably would do in our procurement process in the start of an implementation. It is good to test it with a couple of small services in that scenario. But when we go into our larger implementations, a lot of the time people are like, oh, we need to do a pilot. And then the pilot kind of is this small group of services where we could have rolled out to 10, double the amount of services that we may have in our pilot, and use that resource more efficiently for an organisation. We never say no to a pilot. If that's what an organisation needs to feel more confident about their rollout, we'll absolutely deliver a pilot there. But it just gives another opportunity for people to back out and go, that was too much hard work. We said we'd reassess after the pilot, and actually this is far too much hard work for us. Let's wait another year. It's another back out option. So for me, if you can go for it, go for it. But if you're not 100% on what you've chosen as a software, definitely pilot first. Even try and get a free trial from the software before you go into your full implementation. Gathering feedback's so important in your implementation. You may have done a configuration phase, and then when you first take your system live, it's so important to have kind of check-in points with people, gather that feedback, and then you may need to adjust what you've done in the system. There may be config that you can tweak to make something better. And in real life examples, you find what you thought was going to work perfectly really doesn't work, and you need to adjust it. So always have that feedback loop for staff to be able to come back and say, actually, if it could do this, that would be so much better for us. It'd make it so much quicker. And then, adjust and listen to that.
Yeah. I mean, there's loads of things that you've said in there that I think are super useful. But I mean, going back to one of your first points around like having almost like that expectation that when you start with a piece of technology, especially something that's a little bit more complex, it's not going to just be up and running straight away. You have to have someone dedicated to kind of input in that good data to be able to get, obviously, good data out of it and insights out of it. And then, obviously feedback is so important, isn't it? I think feedback is a massive topic at the minute anyway, with obviously CQC and stuff like that. Obviously, there'll be a few challenges that care providers will typically face during delivery and implementation of a new piece of software, assumingly that like change management will be one. But can you kind of expand on that, your experience at Guided Innovation?
Yeah, I mean, first piece of advice, everyone's going to face challenges in implementation. As Guided Innovation experts in doing this, we face challenges, and the best thing to do is just address the challenge and form a plan as to how you're going to tackle it. One of the biggest ones we see is digital skills. So people who aren't IT literate, you know, like I mentioned earlier, we've got a varying age profile in our workforce in social care. Your tech savvy people will just pick it up and run with it. Sometimes can be worse than the ones that take their time and learn it. They might run off, use the system and just do it totally wrong because they just thought, oh, I don't need to look at that. I don't need training on this system. Hopefully the system will be so usable they can just get on with it. But we have had people trip up where they've just got a bit click happy and got on with that. So it's making sure, you know, when you've got that challenge of IT skills, making sure you've got a range of training available. Make sure you've got videos, you've got written guides. Everyone's got kind of different learning styles that they like to use. And if you've got those videos, you've got those written guides and they're all available at people's fingertips. You know, you might run some face-to-face training sessions or you might do some Teams training for people. Just making sure that you're kind of picking up on whether people are looking scared at the end of those sessions or whether they're just chomping at the bit to get access to the system. The ones that are looking scared, you might need to spend a little bit more time with or check in with after the training and see how they're feeling. It may just be that they're a physical learner and they need to just get their hands on the system and go with it. Or it may be that they sat in that training session and just totally didn't take anything in and were bamboozled. So digital skills is definitely a challenge you will face with your workforce, especially when you come out to your end users and you're not just training managers who are used to sitting on a computer. And then you've got things like resistance to change that you'll come across as a challenge. So with the resistance to change, this is a bit of a tricky one because it's about communication and ideally you want to tackle that before it becomes a challenge.
Yeah.
So if you've got really good communication through your implementation, even when you go out to procurement and you just start letting people know and drip feeding information that you're looking potentially to buy a digital care planning system or a rostering system, for example, they'll start to come on that journey already. They may have lots of questions. You've got to give them an opportunity to express those feelings and questions that they may have. And again, that's about that feedback we talked about, making sure that there's somewhere where people can come and ask those questions so that they can get the answers they need. And then that will help bring them on that journey of change.
Yeah.
And always focus on the benefits. With anyone that's struggling to kind of come along with the change, you need to kind of really sell them the benefits and show them what benefits they're going to feel. So you may have a support worker that's kind of challenging why you're buying a system. Don't sit there and tell them all the benefits for a manager. Tell them the benefits that they're actually going to feel themselves.
Needs,
yeah.
That's a really good point. I think it's all about engagement, isn't it? It's so easy. It's so hard to regain engagement once you've lost it.
Yeah,
so
definitely.
Like you said, it's that communication piece, having almost like a structured plan. And presumably a lot of tech providers will provide organisations with resources, support, training, materials that they can use to kind of distribute communications to their organisation.
Some digital system providers will provide a train the trainer approach, and then internally you can escalate that training and share it with people. Some providers will actually do all the training for you, and they'll even do kind of engagement sessions with your staff. They'll do mini demos to show people how things work. It really depends on the software supplier, the implementation packages that they've got available to you. And sometimes they'll not kind of provide loads because actually they've got a wealth of videos, guides, and they might even have e-learning.
Yeah.
And so sometimes you might look at someone's implementation package when you're procuring a system and it doesn't look like there's a lot of support there. But that's because everything's available to you, within a website that they've got. And a lot of the tech suppliers now have got these kind of knowledge areas, and you can just search for a keyword and it'll bring up 5 articles that talk about different parts of the system that might have that keyword in it. So they're really useful as well.
So then just moving on slightly, obviously I saw you at the Care Show. During that event, you had a speaker session and you spoke about the ideal shopping list. So can you talk to us a little bit more about that and just give us some examples of essential technologies for care organisations?
Yeah, so we always advise to start with what we call an operational triangle. So rostering, care planning and EMA, that's a great place to start for any kind of social care organisation. It'll tick off a lot of your regulatory requirements and help you get more compliant with those. And these ones bring you benefits fast and they touch a lot of people. So you'll be getting benefits for the people that you're actually supporting or caring for, benefits for your staff, your management team, your quality teams, your payroll teams, your HR teams, operations, etc. So they touch a lot of people in those 3 systems. Rostering is always a good one to start with. A lot of the rostering systems will also help you kind of build a bit of a HR portfolio for your staff. So if you are completely paper-based and all you've got is spreadsheets and paper records of your staff profiles, that can really help you get started with at least digitising your people's records and then your rotas and then your timesheets, and then you'll start to get the benefits of helping staff with a better work-life balance, because some of the systems out there allow you to request open shifts, you can book your holiday, you can swap shifts with other staff, and you've got visibility of your rota when you're at home trying to make plans with your family or your husband, etc. By removing paper timesheets, there's a lot of human error in those from the staff filling them in or the managers checking them off. So you can improve a lot of payroll accuracy there, which we know in a industry where people aren't the best paid. Making sure that they actually get paid correctly is very important.
Super important.
Yeah. And you can even potentially reduce your agency. If you're one of these lucky organisations that say they don't use agency, well done, hats off to you. But if you are using agency, then the rostering systems can help with a lot of that as well. Care planning, so your digital care planning systems, they will help a lot with that kind of compliance for your regulatory side. If you kind of got, requires improvement or a good rating from CQC or any other regulatory bodies for that matter, there's a lot of things that just by implementing a digital care planning system, you can start to gain improvements from. Just the sheer kind of daily recordings that you'll record in those systems instead of what you may have had as a daily diary or a few pieces of paperwork that you'd filled in throughout the day, that will all be in one place and you'll be able to get data and insights from that. And also your staff will be able to do speech to text in a lot of those systems, and so they can record better quality notes from word go without even have to do a lot really. A lot of the kind of care planning systems there's not major config for those, so they're quite a quick and easy one to get up and going once you're ready. The kind of time-consuming part comes from those is when you're importing your support plans or your care plans and trying to get all your assessments and things like that in there. But there's no reason why you can't go live without them in your system and they're still paper-based and you start getting the benefits of your daily recordings to start with. So definitely challenge yourself if you're doing a care planning system. Can you go live without putting all your data in there first? And then the third of the operational triangle there is EMA. So obviously a lot of social care providers do administration of medication, and that's prone to a lot of errors, human error or kind of processing errors that can go on between staff picking up shifts and things like that. So obviously a lot of the benefits you can get from an EMA system is your reduction in medication errors or medication incidents. You've got better, more accurate recording. It's no good having mark sheets that have been scribbled on to show updates that nobody can read and you don't know whether that's 2 or a 1 or a 4.
Probably happens more often than not.
Yeah. So again, just having that kind of a digital record, it's really clear to everybody exactly what should be happening when and how many tablets somebody may be having, for example. And there's a lot of kind of time efficiencies that you can get from an EMA system as well. So obviously you can have faster stock checks, you can do your audits much faster. And actually kind of giving people meds should be a quicker process because it's just all there ready at your fingertips in an app usually as well.
Yeah.
There's lots of other items you could put on your tech shopping list. I mean, we could sit here and talk all day about what systems are out there, but Outside of your operational triangle, incident management's a big one at the moment in terms of making sure that you're being proactive and adjusting your processes in response to any incidents that are happening. You've got your HR and training platforms, payroll and finance systems. Again, it really does depend on where you are in your digital journey.
Yeah.
And like I said earlier when we were talking about procurement, what problem do you need to solve first to kind of get those benefits quick and then make those improvements? If we start talking more about innovative tech, you've got your IoT sensors, your AI monitoring, you've got wearable tech. The world really is your oyster when it comes to social care tech. It just depends where you kind of are in that journey and what problem you need to solve first.
Yeah. Would you be able to give an example of potentially like a problem and where they are in their journey, and then the kind of solution to apply to that problem, if that makes sense? Because I know obviously there is so much tech and maybe people are a bit like, oh, where do I start? I know obviously you mentioned the operational triangle, but potentially picking one of those and then.
Yeah, so let's say you've done the operational triangle, you've got your rostering system, you've got your care planning, and you've got your EMA. Let's assume you've already got HR, payroll and finance kind of tickety-boo and they're all sorted. The next place you might start looking is to kind of go into the AI scene or the IoT sensors. There can be a quite a high budget required for some of these projects. It depends on the supplier you go with and what kind of tech you go for. But if you go for, the sensors, these can be really life-changing for people that you look after. It could be a mattress pressure sensor. It could be a sensor to detect falls. And we all know that falls are the reason why a lot of elderly people get hospitalised and potentially don't come back out of hospital. So some of these things can really revolutionise then the support that you can provide and actually make you an even better kind of care provider there as well. So definitely worth considering, your IoT sensors and your AI monitoring once you've kind of solved your main stack of systems.
Yeah. No, I think, definitely IoT devices are incredible. We've had a few podcasts where people have referred to how they've had like temperature monitors on their fridges and stuff like that. And that in itself not only helps the patients that they're looking after, but it reduces the time spent on someone going back to the fridge, checking the temperature every hour, that kind of thing. So that then that carer is freed up to spend more time with that resident or patient, which obviously equates to better care.
Absolutely, yeah, definitely. There's so many options out there when you come into that side of things, into your sensors and your AI tech. And, there's so many benefits you can get from that you can provide. And I think the main benefit would be that you don't have to do those mundane tasks that a system can then do for you. You can spend time being a human and being a compassionate person, helping that person and spending quality time with them rather than, like say, checking the fridge temperature, checking they've had a cup of tea, checking those kind of things. So, yeah.
And I think, that is a really good point, actually. I think a lot of the tech that we've just mentioned is almost to do that, isn't it, as well? It's to replace those, them manual tasks that you're doing constantly, sieving through data and stuff like that, saving you time to just almost like show you the insights automatically so that you can go and do your job better.
Yeah, and a lot of people do kind of, they attach the stigma of introducing tech with, it's going to take me so much longer because I can't just scribble it. Once you get used to something, it becomes the norm. It's so much faster. And then, for me, that is the point of tech, is that then you can spend time being a human instead of doing those tasks that you're distracted away from the person that you're supporting. You can sit with them and have a conversation and talk about what their kids used to do and reminisce and all that kind of thing and plan what they want to do in the future. So
do what they do
so
best.
Much better to do as a carer or a support worker than sitting writing paperwork, surely.
Yeah, 100%. So touching on that slightly then, we have kind of talked about this a little bit, but obviously, like you just mentioned, some people might be a bit reluctant to adopt the tech. So implementing new technology often brings significant changes. How do providers kind of implement this and navigate through change management and maybe people that are a little bit more reluctant to adopt new ways?
So we have touched on a few of these, but kind of to recap, communication is key. If you can communicate, you'll be onto a winner. The the communication isn't just about telling people, though. It's about that listening. We talked earlier about kind of feedback loops and making sure that you're engaging and checking in with people. That's the kind of most important part is, yes, telling them what's happening, what's next, what are the updates, etc. But then listening to the feedback that might come back in or the questions and being able to answer those and be responsive about how you answer those is so important. That will let your staff feel listened to. It's no good just keep telling them, this is going to make your life better. I promise you it's going to make your life better. You need to be able to talk about those benefits that we mentioned so that they can understand why it's going to make their, work life better.
Yeah. And see it in practice, I guess, as well.
Absolutely, yeah. If there's any way of demoing, giving people sneak peeks is a great thing. People love a sneak peek video when we do it. We'll try and get one of those out as early as we can in an implementation and in the comms plan there. And important as well to have that feedback loop after you've implemented. So the change management isn't just in the procurement journey and in the implementation. Once the system's live, once you get into kind of business as usual, it's so important that you've got some kind of mechanism to have that feedback loop and communication continuing. Things will change in your organisation. Processes will need to be adapted. CQC may make a new announcement and they want things done differently. You've got to be able to adapt and respond to that. And so it's important to keep that feedback loop going even after your system's alive.
That's so true, isn't it? Like the sector itself moves so fast that something that worked potentially a year ago is probably not going to work anymore in terms of the process, and their policies will change and all that kind of thing. And like you just mentioned, regulatory as well.
Yeah. And I think what's also important whilst you're doing that communication is celebrating the wins. No matter how small that win is, if somebody's giving you a really fantastic quote, use that as a success story to share with other people. If someone's asked a really tricky question, communicate that to people and let them also know, because they might be thinking the same but not willing to ask it, or they might not have had time to ask it. So recognising those wins and also sharing the challenges that you get faced with as well will be important to kind of share and shape that culture of that open and honest, we're all on this journey together. This isn't being done to you. And I think that's a phrase that, we hear people say sometimes is, well, they just implement it and we've just got to go with it. We don't really get a choice. It isn't being done to you if you can have that real engagement and communication strategy. People are being brought on that journey. And if you allow people to get involved in that procurement strategy right from the start, giving your support workers, some team leaders and some managers opportunity to join in, they're going to feel like they're on that journey and they're going to bring people on that journey with them as well.
Yeah, and I love that, celebrating the wins. I think that is such a good idea because we've kind of entered this new era, I think, where you're seeing a bit of a narrative shift. A lot of, obviously, within health and social care, a lot of focus is on the negatives. But now I think people are realising that recognising the positives, recognising people's voices, and when they make, like you said, a good point or they ask a good question or something like that is so important, because then it almost like prompts other people to do it. And it also makes the person that did it obviously feel good and want to do it again.
Absolutely, yeah. It gives them some recognition, doesn't it?
Yeah, definitely. So just finishing up then, final question. Looking ahead, what emerging trends or innovations in care technology should organisations be keeping an eye on?
Well, if you haven't heard about AI, I'm not sure what rock you've been hiding under for the last few years. AI seemed like the hottest topic of 2024.
Yeah, it's everywhere.
Is still one of the hottest topics of 2025. If you have got any systems, I'm sure you're hearing about your suppliers saying, oh, we're introducing this with AI, or when you start looking at your procurement journey, there'll be lots of people talking about AI. Obviously, there's questions around its ethical use and making sure that it's used appropriately within social care and we're not sharing data into open API tools that then is public facing and things like that. But, it's proven to be a fantastic tool for marketing teams. The efficiencies a marketing team can use from things like ChatGPT is amazing. They can just chuck a few words in and it writes them a social media article. No offense, marketing people, I know you're fantastic, but I know for me doing the marketing for Guide Innovation, ChatGPT is my best friend.
Yeah, nice little assistant.
Yeah, but there can be dangers to using AI as well. So, it's making sure that people understand the role of AI in social care. It can be there to help produce paperwork for you. If you said, write me a support plan. It can write a support plan for a person. Is that going to be person-centred though, based on what that person needs? And this is where we've got to make sure we've got the right models of AI in place to support somebody and to make sure we're shaping social care in the right direction and we don't move away from that person-centred approach, because for all we know, an AI tool will then write the same one for the next 50 people. So, it can have its benefits and it can have its uses for your creative side of things and for some of those tasks that may be more mundane.
Yeah.
But I wouldn't be asking it to write me a support plan just yet.
And I think that goes back to your point earlier about that it's about tech is almost in place to help you do the human things.
Yeah.
And I think AI is a perfect example. ChatGPT is a perfect example. It's never going to replace the human. It's never going to replace the person in care. And it's almost like a tool. So I went to a speaker session not too long ago all around AI, and he basically kind of said that AI should be seen as like an intern. It's there to kind of support you, but you need to train it up, and it's not going to always have all the answers. You need to put your touch on it, the human element on it.
Absolutely. It can be another tool in your toolkit to help you out in certain circumstances.
Yeah.
But, there's some really exciting uses of AI that are being put into tech at the moment. So imagine you've got your care planning system and you've got your policies and procedures system, and your staff turn up for work. They missed a training session last week and they need to hoist Dorothy. Dorothy likes hoisting in a certain way, and she likes to be sung to while she's hoisted because it makes her a little bit nervous. But then also in your policy and procedures, it's going to advise you how you should hoist anybody in that organisation, not just Dorothy. In your care planning system, you've got how Dorothy likes to be hoisted. In your policies and procedures, you've got how to hoist safely. Imagine if you could just talk to the system and say, how should I hoist Dorothy today? You've never worked with Dorothy. And it says, Dorothy likes to be sung to, and this is how you must do your hoisting in line with policy. And it just does that for you. If that was somebody who's missed their training, for example, or they've not read the policies and procedures, they could have either hoisted Dorothy unsafely, they could have not sung to her and she'd have got distressed while she was being hoisted, or they'd have had to go back to the office, sit and read Dorothy's care plan, sit and read the policy and procedure around hoisting, and then do their job. By which point, Dorothy has been sat waiting an hour to be hoisted.
Yeah.
And that's not nice. So if AI can serve a really good purpose in systems where it can bring lots of information together and save you going and finding that information out. And we know, if you go into systems, you can end up sat there for an hour trying to find information. If you go into a filing cabinet, it might take you even longer. If AI can do that bit of joining information together and bring you the person-centred approach and the safe approach in those kind of circumstances, you're onto a winner because it's going to save you so much time.
Yeah, and I think the key there, isn't it, is that AI is extremely clever and useful if it's used right.
Absolutely. In your digital planning systems, you may have thousands of daily records. You may have thousands of records about how James eats his breakfast every morning. But unless you sit and read the handover notes, or unless you sat and read James's notes every single day, you can't take all that in. You're doing a million things in one day when you're a support worker. If AI could say to you, since you last worked here, Rebecca, this is what's happened with James. He now prefers to have toast with jam on instead of toast with honey. Please make sure you give James toast with jam on. Those kind of things can make such a difference to the person you're caring for life. And you wouldn't have had time to sit and read through all those daily notes since you last came on shift to find out that he's now changed his mind. He doesn't want honey, he wants jam.
Yeah.
So, but that can make such a small difference that's such a big impact to that one person.
Yeah, definitely. 100%. I love that example.
It seems like such a simple example, but where people can't communicate, James might not be able to tell you that he now wants jam instead of honey. Yeah,
exactly. And I think it is even though it is such a simple change, it is those things that make a massive difference to someone's day.
Yeah, absolutely. And, especially in learning disability charities, you'll start to see people exhibiting behaviours because, things you've done have upset them. And that's not their fault. That's our fault for not being able to keep up and know what's been happening in the previous days. It may have been that James had an incident and he associated that with the honey that he was having on his toast. And so he no longer wants toast. So it's important. These minor details can really make such a big impact. And they're things that we may even overlook, but an AI would pick up.
Yeah.
You know, it may be something that seems like such a minute detail, we wouldn't even notice it.
Yeah. And this conversation that we're having now links perfectly to the podcast before, that is all around like communication with nonverbal patients. And I think AI and technology and everything like that is a massive stepping stone in how to better support these patients.
Yeah, definitely. Another one that we think is going to become quite a big important topic in 2025 is reporting and data infrastructure. So essentially the storage and movement of data across multiple systems. There's lots of people out there now who've got multiple systems that do need to talk to each other. And to make that AI we were just talking about so much more effective, you need to be able to kind of either get that data into one central pool where you've got a data lake potentially, where you're extracting all the information from all those systems into one place, and it can be held and looked at and interpreted in one place, or integrations between systems. So you've got, your systems are all communicating with each other. AI is fantastic, but it needs that data. And that's where we can see that people are going to start, transforming now. Instead of just having all these siloed systems who may have, your Nourish might be connected to your radar, for example, but that might not be connected to your rostering system.
Yeah.
There's data in all those systems that can really connect to each other. And that's where your AI could become really powerful. It could spot insights between those three systems that we would never even thought about, because you might have different users in each one.
Yeah.
And they may not cross over, they may not look at each other's data. And how can a person sit and churn over as much information as an AI can? I don't think we possibly can. They outpower us in that sense. So yeah, I think it's going to become really important that people can access all their data and also amalgamate it so that it can be interpreted, get insights from it, and then make proactive decisions based on what you're kind of being presented with from your data.
Yeah, and I mean, it goes back to that point that you made earlier about kind of removing the duplications and those mundane tasks and just kind of automating them to make not only your job easier, but then giving you more time to focus on caring.
Yeah, definitely. Sensor technology and virtual support is going to be a fantastic innovation that we hopefully see more people using and potentially trialing if they're not sure if it's worth the kind of, investment in those, starting to trial them in their services. We've been having lots of conversations lately about sensor technology and trying to push people into that space next, because we've already done, some of their tech system implementations. There's now over 15 sensor technologies on the market in social care of varying, your wearables, your temperature sensors, your mattress sensors, etc. So there's lots of different options available to start having a look at. And we expect in 2025 that we'll start to see the benefits of some of the people that are already using those and starting to share and talk about it a little bit more. And the people that are kind of willing to start having a trial and having a little dabble in that area of innovation, and seeing kind of how the investment there is outweighed by the benefits that we can give to people in support and care.
I mean, it's all super exciting, isn't it?
Yeah, definitely. We're excited to do some more sensor technology implementations. It's where Grant geeks out, definitely.
It is super transformative though, isn't it? Especially like we've talked about patient care all the way through this, but to patient care, and I think it's just, again, I'm going to repeat myself, but it is removing those mundane tasks of going to check the fridge to see what temperature it is, and almost having it just as an alert so that and it's almost like that audit trail then.
Yeah, and it's starting to report by exception. Instead of having to check something every hour, if you can set some parameters as to where that should be sat, you can then just be exception reported as and when there's a problem, or as and when it's starting to become a problem because the temperature is changing, for example. You can then proactively do something about that before it becomes an incident.
And better manage your risks.
Yeah, definitely.
So thank you very much for all of that. It's been super useful. So as you may know, at the end of each episode, we always ask our guests what the HealthTech moment is. So basically this can be anything from funny or weird or something that's a really standout moment within your time in healthcare.
So mine's got to definitely be when I first started working as a compliance coordinator at a national brain injury charity. I was responsible for all the rotas across the community services and dom care services. And we had one particular 24-hour dom care that was at home with his mum, and it was in the south, and the gentleman lived at home with his mum, like I say, and the area was really poor for recruitment. We couldn't recruit staff to that area, and so he had one lady that did go in and work with him and would do 3 days on the trot, because that was the only way we could cover the package. And then the rest was covered by agency staff coming in. Now, this gentleman couldn't be supported by males. He could only be supported by females. And the lady that did kind of work with this guy, she went off sick. And so then we had to try and find 24/7 cover for the guy who was living at home. And we already struggled to cover this with agency because even they had a recruitment issue in that area. And, you know, we were paying fortune in agency to cover this package. And one of the things that used to happen quite regularly with this package is it'd get to Friday, I'd be finishing my Monday to Friday 9 to 5 job, and I'd be thinking, I haven't got cover for this weekend still. I know that when that agency worker finishes in the morning tomorrow, Saturday morning, I've not organised anybody to come in for this. Not because we hadn't been trying. This package in this particular area was just impossible to cover, but this guy needed support. And so I'd be handing that over to an on-call manager who I knew had no other options than I did to be able to try and cover this. And we were on a wing and a prayer that agency would find somebody to cover. Otherwise, that poor agency worker in the morning would not be able to go home for the weekend. And that to me was like, we've got to solve this. There's got to be a way that, you know, this guy at home, you know, maybe he needs to move, maybe he needs reassessing, maybe AI technology could help him and he doesn't actually need somebody there 24/7. And in that situation, no matter how many times that happened, we were kind of stuck, and that was a repeating pattern that we were stuck in, and nobody was kind of finding any answers to solve it other than try and recruit somebody, which we knew was impossible in that area. We tried for 2 years to try and recruit somebody to that. So really emotional time, you know, sat there at 5 o'clock thinking, oh, I'm going to have to bring that on-call manager and ruin their weekend, knowing they're not going to be able to satisfy this person's support package. So that's kind of what really inspired me to think outside the box and to think about what tech can solve. And there's always an answer to everything. It might not be what you think is the normal answer, but there's always got to be an answer to everything to make something better.
Yeah. And I think it's just about that willingness, like you've just said there, is that willingness to be able to find something like an innovative solution to a problem. We know that recruitment is a real issue within social care. And obviously there's been a few different initiatives that have launched and it's still an issue. So it's almost like, how can tech support with these issues and obviously help that gentleman that you were speaking about? Because at the end of the day, these kind of things do impact not only the staff, because they're obviously having to work overtime, et cetera, which then puts people at risk of higher churn. But the patients at the end of the day that are kind of getting the brunt of it.
Absolutely. So my answer to everything is to look at what technology can do for you now and look at what other solutions are available and think outside the box.
Well, thank you very much for sharing that story. And thank you for joining us this week. And thanks to all you at home for listening. Join us next time for another new episode. And don't forget to like and subscribe. And if you have any questions for us or our guests, please email whatthehealthtech@radarhealthcare.com.